Hello, my name is Danielle Hickson, and today I will be talking about the young generation and chronic illness. A lot of people, when they think of chronic illnesses, they think of elderly people, people that are in a walker, or people that need a wheelchair, or something along the lines of that. They think all chronic illnesses is something that has to be seen. What average age do you think most people get diagnosed with a chronic illness?
Middle-aged people.
I think elderly.
Elderly? Actually, none of those answers are correct. People that get diagnosed with any sort of chronic illness can get diagnosed at any point in their life, whether if they are a baby or an elderly person or somebody in their 20s. Today, I will be focusing on rheumatoid arthritis, which is a chronic illness. The first point I would like to point out is what exactly rheumatoid arthritis is. It is an autoimmune disease. It happens when your immune system is actually attacking the healthy joints and tendons and ligaments within your body. It is a chronic illness. It causes stiffness, generalized weakness, fatigue, pain, and especially the loss of the functions in your joints. The symptoms include joint pain, swelling, fatigue, muscle pain, can also cause fever, stiffness, major fatigue, The next thing I would like to tell you is a little bit about me. I was diagnosed with rheumatoid arthritis at the age of 19. I was a sophomore in college. I was taking a full course of 4 hours at the Texas Women's University, and I was unable to complete school or really go to work to complete all my tasks because I was in so much pain, which caused me to be depressed and have real anxiety about my illness. I also could not perform daily activities such as going upstairs, walking in my car, putting my shoes on. Pretty much I needed help with everything. Next, I would like to show you some images of my flares. To the left of me, you can see that my left elbow is extremely swollen. They actually thought that I had a blood clot in my arm because they thought there was no way a joint like that could swell. And then shortly after my doctor's appointment, here's the other image, my forearm, and the swelling had gone down to my forearm, which was rather massive at that time. When people think of rheumatoid arthritis, they want to compare it to osteoarthritis. There is a huge difference in between these two that a lot of people do not know about. Rheumatoid arthritis is an autoimmune disease. It's within your body. It's something that you cannot prevent. Osteoarthritis is also something you cannot prevent, but it's more of a wear and tear disease, and a lot of people end up having it. The side effects of rheumatoid arthritis is the loss of energy, fever, fatigue, etc., like I had said earlier. And osteoarthritis is joint stiffness, decreased motion, and pain. Rheumatoid arthritis usually starts within the smaller joints, but it can go to your bigger joints such as your hips, knees, elbows, things of that sort. And osteoarthritis is mainly in weight-bearing joints, so your back, your hips, your knees, things like that. There's also a difference at what times that these occur for people, such as with rheumatoid arthritis. It is mainly in the morning or when you have been resting for a while and you've stayed still and non-active. For people with osteoarthritis, it is for people that do too much activity on their joints that they don't really have, or on their bones that are wearing down within their body. The average age for rheumatoid arthritis is 30 to 50 years, but it can occur in any age. Whether in osteoarthritis, it is an elderly age. And here at the bottom, you can see that people with rheumatoid arthritis are less diagnosed than those of arthritis. Next thing I would like to speak about is the medications of rheumatoid arthritis. These medications can be extremely hard on your body. Some even consist of chemotherapy. You must meet with a rheumatologist in order to get these medications. It can take up to weeks, even months, for these medications to kick in. And here are some examples of the medications that are prescribed. The DMARD is a slow, it tries to slow down or stop the progression of interrupting the immune system in order to slow down the disease a little bit. It can take up to 6 months to interact with your body. The NSAID blocks enzymes that cause inflammation. This can reduce swelling and pain, but it is used for smaller periods of time. It's mainly Advil, or a prescription medication is Celebrex. Next one, the biologic response modifiers. Those target the part of the immune system response that leads to the progression to help slow down the disease, which can often lead to remission of the disease. Medications like this are Actemra, which are an injectable, while the other ones that I have currently mentioned are in pill form. The the allergenics reduce pain but not swelling. They are narcotics such as Oxycontin or hydrocodone, but they can also be Tylenol as well. Another side effect of rheumatoid arthritis can also be mental health. A lot of people, when they get diagnosed with a chronic illness, tend to have depression just because it is a life-changing event. It is something that just kind of reaches up and smacks you in the face and says, here I am. So, but the improvement of pain and joint stiffness and range of motion can help reduce the depression. And it can also cause heart attacks and strokes just from the stress of having depression. Another issue with having rheumatoid arthritis is trying to bear a child. You must be off all your medications for at least 3 months before even trying to conceive a child. This can cause for patients to become very stressed, very depressed, in a lot of pain, and a lot of swelling. Pretty much anything you can think of, they will go through. So you are off those medications for 3 months, and obviously while you're pregnant, so you're off all your medications for at least 1 year. A lot of patients do say while they're pregnant that they do feel a lot better, but it's not a proven study. There's also issues of breastfeeding. When you do have your child, obviously you cannot breastfeed and take the higher doses of medications. It is not safe for the child. And if you do take your medications while you are pregnant, it can cause deformities or miscarriages or stillbirth. Also, they have shown studies that mothers do have epilepsy after having a child with rheumatoid arthritis. Next thing I would like to ask you, how can you imagine having this illness at such a young age, and how do you think you would handle the pressure? Terry?
Well, obviously you have no choice. So you have to either let it beat you down, or you have to decide that you're not going to let it beat you, and study it, learn about it, and listen to your doctor, attend all of your appointments, and decide what risk and what medications you're going to go for.
Good answer. That was a good one. So living with rheumatoid arthritis at a young age. So when you pull up to a parking spot and you see somebody of the ages of in between 18 and 30, and they get out of their car and they're walking just fine, and you're like, oh, you don't need that. What is the first thing that you think of that person? Katie?
It's their grandparents' handicap sticker.
Do you think anything out of these answers? That maybe they're just being lazy
Yeah.
or... Well, unfortunately, some people do need it. This is why rheumatoid arthritis and some chronic illnesses are actually called ghost disease. The reason they are called ghost disease is because you cannot see it. You cannot see when somebody is sick or in pain, or they need medication. This can cause depression to resurface from the initial diagnosis. People will end up judging you, saying, oh, you're fine, you'll be okay. Although underneath your jeans, your thigh is 3 times the size it should be. And nobody can tell you that you're feeling bad and you take it personally, anything like that. And a lot of people just think that you're lazy and you're not trying. The next section I would like to speak about, and one of my final points, is to just think before you speak. A lot of people just want to say, oh, you're okay, you're 25, you're fine, don't worry about it, you'll be okay. Just try to put yourself in that person's shoes. Try to be considerate. Try to think about what the kind of day that they've had, just as maybe they're thinking about you and maybe they think you're lazy and maybe she had a long day. Try to understand that they cannot be at every event. This one is highly important because I have read an article and it's called Running Out of Spoons. And when you run out of spoons, you can't do anything else, which does happen quite often. Now that you know all of these facts about rheumatoid arthritis, I just want you to think about how this will affect your daily life and how you might look at others differently, and maybe try to consider that they do have a ghost disease and you just can't tell there's something wrong with them. Do I have any questions?
I got one, the cameraman.
Yes.
So you're talking about the difference between rheumatoid and osteoporosis. Generally, on your joints, which one will affect the joints a little bit quicker than the other? Like, is replacement a thing, or is it not a thing for one or the other? Or does it happen more with other?
Currently, with the rheumatoid arthritis, joint replacement isn't a typical thing that people with rheumatoid arthritis go through more than people with osteoarthritis, because with osteoarthritis, it's your actual bone structure breaking down. Rather than with rheumatoid arthritis, it's your joints, which provides the cushion and the comfort for your legs or your fingers or arms or whatever to move smoothly. So it just honestly depends on the progression. Luckily, with getting diagnosed at an early age of rheumatoid arthritis, you can catch it soon enough and try to avoid some of the damages of rheumatoid arthritis, and try to avoid those creepy witch fingers that you see in most rheumatoid arthritis images. There's my references. Anybody else have any more questions for me?
Yeah, how is your pain levels today?
My pain levels are actually pretty great today. I was able to get back on my medications. When you are sick, since your medications do shut down your immune system, you do have to get off all of your medications. So like last week I had a sinus infection, and since I had that, I had to get off all my medications, which I take about 16 to 20 a day, and it affects you greatly. You can tell within a couple of days that you've been off your medications.
So what is coming down the pike? With this being such a long-term chronic illness, that you have to manage, like say diabetes or something like that, is there anything new coming down the pipes that has any possible effect on cure?
Scientists have been working really hard to find a cure for rheumatoid arthritis. Unfortunately, right now there is not a cure. The one pill that does work the best is methotrexate, which is a chemotherapy. A lot of patients do take the methotrexate, but when you're 21, you're sitting in your doctor's office and they're like, oh, you're gonna have to take chemotherapy, it kind of freaks you out a little bit. So me personally, I like to explore all my other options first, and then if I have to take the methotrexate, I will. But they are working on trying to find better solutions to alleviate the disease.